Hi, everyone. My name is Julie Woon, and I am your host today for the YMyHealth podcast. And for this episode, we have guest Dr. McCord Delaney. She is a U.S. veteran and an assistant professor of clinical emergency medicine at Georgetown University. And with her background in both military service and emergency medicine, she's going to bring a unique perspective to how we think about care in critical moments. So today, she's joining us to break down the important differences between emergent and urgent care, what they mean, when to seek them, and how making the right choice can impact your health and peace of mind. So, welcome to the podcast, Caitlin.
Thank you, Julie, for having me. I'm excited to talk about the subject.
Excellent. Well, just to do a little introduction, can you share more about your background and how you came to work in emergency medicine?
So you gave a little bit of my backstory. I am right now working clinically in a busy emergency department in Washington D.C. So we're a trauma center and we're also a referral center. So we see a lot of patients, and we have a lot of patients who are sent to us from other places in the healthcare system, including urgent cares. And I found myself drawn to emergency medicine because I wanted to know that regardless of what setting I was practicing in and regardless of what patient came in, I could help them. And so really any patient, anytime, any problem, it's something that I wanted to know that I had something to offer them. I also really like that it's a specialty that there's a lot of chaos sometimes in the emergency department. Anyone who's been a patient in the emergency department can probably attest to this, but I like to try to be able to bring some calm to that environment. And it really is a privilege to be able to be there for people, sometimes when they're stressed and struggling to navigate the healthcare system, but also sometimes when it's one of the worst days of their lives. So that's what really drew me to that field.
Yeah, absolutely. And I think a lot of people who don't have medical backgrounds or experience, it's hard to understand the difference maybe between emergency care and urgent care. So, from patient perspective, how would you explain the two?
So, like I was just talking about, the emergency department is a place where really it's set up to handle pretty much everything. So, no matter how severe the situation is or how uncertain the situation is, urgent care is a really great option because what we try to avoid happening, and sometimes it's unavoidable in our healthcare system, but we try to, even though we're equipped to handle things, we try not to have every patient coming into the emergency department for their medical care just to because that can lead to increased wait times and things like that. So urgent care is a really great option when it's something that's a little more minor. So maybe like an ear infection or a cut that you think might need some stitches, so it needs some medical attention. I think we'll talk a little bit more about that later, but the the ER is primarily built for those life-threatening emergencies that really can't wait. Urgent care is more built for things that maybe if you were able to get a really fast appointment with your primary doctor, that would be great, and you could see them. But it's really more built for convenience and speed with lower risk issues than the emergency department.
Got it. That totally makes sense. So, I think you started to touch on this, but can you break down the sort of conditions or symptoms that should be maybe seen in an ER versus an urgent care? So, if someone's confused on, is this serious enough that I should really go, or urgent care is sufficient? What would those be?
Yeah. So, I mean, first, I'll just say if you're ever really worried about some condition or you feel like it's rapidly worsening or you're unsure, you can always come to the emergency department. But there are a list. So, one of the places that you can go to look at what conditions would qualify for each type of care is the American College of Emergency Physicians. Their website has like a pretty good list of what kinds of things you might want to go to an ER for versus what kinds of things would you might want to go to an urgent care for. So, for example, the ER is a good place for things like chest pain, or if you're really having difficulty breathing, stroke symptoms, major injuries, if someone is really confused or not acting like themselves. These are higher acuity conditions, and they're probably going to need a lot of the resources of a hospital setting. Urgent care is better for things like I mean, we touched on a couple of them before, but let's say you have a cold or a sore throat, you want to see if you need antibiotics. Maybe you have a sprained ankle, or even if you're worried that it's a broken ankle and you think you need an X-ray. Those are kinds of things that are good for urgent care.
Yeah. Are there any situations that you think you see people come in and it's like a gray area of
Yeah, I mean, I think yeah, that's for sure. I think that's one of the reasons why we're doing this podcast even is it's really hard, and we don't expect patients to always know or to have the medical knowledge to make that decision themselves. That's why we're there. So we're going to help you through the diagnosis and treatment of it, and you might not always land in the right place, but there are definitely some gray areas. So things like abdominal pain would be one thing that comes to mind. So sometimes maybe abdominal pain, you need a prescription for some nausea medicine or an acid blocker or something like that. And sometimes it could be a sign of something more serious, and you might end up getting transferred to an emergency department so you can get a CAT scan or a surgical consult if they're worried about your appendix. Another gray area would be a headache. Things like headaches that feel like your usual headache and maybe had a gradual onset, things like that could often be handled in urgent care. But sometimes headaches are really severe, especially your headache that's out of character for you as the patient, or that comes on really suddenly from 0 to 10 out of nowhere. Those are the kind of headaches that we do like to see in the emergency department.
yeah, I think maybe sometimes people get intimidated by the idea of going to an emergency care center. And so just having that, general range and idea of what maybe is or isn't a sign, but just knowing, like you said, that if you're really concerned, you can always go. There's no reason, that the facility specifically will hold you back.
Exactly. Yeah. Yeah, I mean, and I think there are different ways to look at it. I mean, you can look at what the complaint is, and then you can go to a website like ACEP, the American College of Emergency Physicians, and you can kind of look at like where do I fall here. But the bottom line is always, if this is something that you're worried about waiting to be seen for, if it's something that's worsening, if it's something that, feels really severe, then the emergency department is never the wrong answer. Also, most emergency departments are set up to kind of have an area where we can see patients with lower acuity complaints once they go through triage. And the triage process is when you check in at the front of an emergency department and you meet with the triage nurse who has specific training in being able to sort through patients and try to figure out which are the patients who are at a higher risk of something going wrong, or of having a more severe emergency condition. And so just even the ability to walk into the emergency department and meet with that person, that can be really helpful in sorting through like whether it's more of an urgent care type complaint or an emergency department type complaint.
Absolutely. Yeah, that's great. I know that unfortunately in our healthcare system, there are maybe sometimes other factors that come into play when deciding to go to the emergency room. So, can you talk a little bit about if time of day, access, or cost could also play in the decision making process?
Yeah, that's a really good question. I think so. Emergency departments are open 24/7, whereas urgent cares are designed for convenience. So they will generally have some off hours time, more than just banker's hours, but they are often not open 24/7 like an emergency department is. So sometimes the time of day is definitely a factor. And the emergency department is, we understand that we're this is like something where if it's something that's happening in the middle of the night that still is concerning to you, then we're there. I think one of the other things you mentioned, like just navigating the healthcare system as far as your insurance or the cost or things like that, it can be helpful to know what your local urgent care options are and what your local emergency department options are, even like before you would actually need it. So before you're in a time when you're worried and feeling sick and feeling stressed about that, it's good to kind of know what your options are. And then it's also good to know at least a little bit about what your insurance plan covers. Some people have quite high emergency department copays, and then people can have varied copays on an urgent care visit as well. Again, if it's a true emergency, I think going to the emergency department is really worth it because you're going to get met by that triage nurse who has that expertise to sort you into the right bucket and make sure that you're, even if you end up waiting for a while in the emergency department, that you're in a place where people can handle it if something were to worsen.
Perfect. So, are there common misconceptions that you hear about urgent care or the emergency room? Yeah, that just frequently come up when you're talking with people.
Yeah, so there are 3 misconceptions that come to mind. I'm sure there are more than this, but these are 3 of the ones that I've heard recently, at least. And one of them is that people sometimes, not always, but can assume that an urgent care could do everything that an emergency department can. And so it's things like thinking, "Oh, I'm feeling really dehydrated and I could hopefully just go to the urgent care and get some fluids." Some urgent cares are set up to do that. A lot of them are not set up to do interventions like that. So if you're really dehydrated, you might end up getting sent to an emergency department. And then things like thinking I'm worried I might need a CAT scan because I don't know, I fell or my child had a fall. And they fell off the monkey bars and they hit their head, and I might need to get a picture of their head, and thinking that an urgent care would be equipped to handle something like that. And that's another thing where you would generally get sent to an emergency department for that type of more advanced imaging. And so, I mean, I think that's something that's hard to navigate as a patient. We talked about that already. But urgent cares have different capabilities, and then we also don't expect you to know what your diagnosis is and what kind of a workup you're going to need before you come in, and that's totally fine. So again, erring on the side of the emergency department if you really don't know is completely fine. I think the second misconception that we'll see is on the side of urgent care versus primary care. So I had a patient say to me at one point that they said their primary care doctor was actually really good at getting people in for appointments, which is great. This is something we don't always hear in like today's day and age, but they said they didn't think that going to their primary doctor when they felt sick was the right move. They kind of viewed primary care as only for preventative care and screenings and things like that, and not for treatment of any acute medical condition, even if it was a UTI or a sore throat or things like that. And that's not actually the case. The primary docs, if sometimes are overloaded with appointments, but if they have availability, they would love to provide continued care to you. They know you the best and better than the urgent care systems do. So think about also that you're not just deciding between urgent cares and ERs. You also might be deciding between, does your primary care have an appointment, and is this something that they could treat you for? And then the third thing that comes to mind is sometimes we in the emergency department will get patients transferred from the urgent care setting, and that's not uncommon for the reasons that we talked about. Sometimes there's an expectation that, well, I've already been seen at the urgent care. They already came up with some kind of a plan there for me, and they're sending me here just for the plan to be carried out. When you arrive at the emergency department, you do go back through the triage process. And so all the patients in the emergency department are seen in order of their acuity, or in order of how sick they are and how worried we are that they might decompensate further by waiting in the waiting room. And so that's true whether you have arrived from an urgent care, whether your physician called ahead to let us know because they were worried, whether you arrive by ambulance versus a private car. And I think sometimes patients can be frustrated because they're thinking, well, I was sitting here. I've already been to the medical setting and I was sent here to get these things done, and they're not they're not getting done quickly. I'm still having to wait and I feel like I'm starting over. And from a patient perspective, I've been there, and I do totally understand that. Really, what the urgent cares are doing is they are realizing that this is a higher level problem than they're equipped to handle. And so they are sending you for a consult from another doctor. And that's an emergency doctor, and we're specialists in emergencies. And so I think a lot of times the urgent cares like to reassure patients that we can speed this process up for you. We'll call ahead to the emergency department. And they certainly do try to do that. They call ahead, and that can help decrease the overall length of stay for a patient. So maybe they'll say, for instance, we were really worried about this patient's abdominal exam, and we really think that he needs a CAT scan. And so if they give us some good a good note like that, then perhaps it might be appropriate for the patient, as soon as they go through the triage process, to have a physician review the triage nurse's notes and place an order for a CAT scan. But there are also times where we're being asked to consult as emergency physicians, and we really do need to see the patient first, and we need to talk to the patient first and really understand the whole problem. And so you do end up waiting again to get another opinion. So I think those would be my three things that came to mind.
Yeah,
I'm sure there's more, but
I think that's great. I know one of the things that I've maybe heard in the past is that people are convinced that if they're going to an ER for something that may be non-emergency, that that could take resources away from critical patients. And there's, concerns because they're seeing stuff on the news about either lack of resources or, issues with finding enough, um, doctors, nurses, and staff to help support these areas. And so I was curious if you could talk a little bit more about that.
yeah. I think that we are seeing increased wait times in emergency departments around the country. This is not just in, busy hospitals in the middle of cities, but around the country, we have seen increased wait times. And the research shows that it is more due to patients who are waiting on beds in the hospital, and we call that boarding. That's what that phenomenon is called. Than it is due to patients who are coming in with new complaints. The emergency department is set up to take care of patients from the really sick to kind of the more straightforward and more urgent care like complaints. And we even have different processes where if you go through triage and we think it's something that isn't going to need quite as much workup or take as much time or as many resources, you can kind of get placed into an urgent care like system, but still have the resources of the hospital at your disposal too. So that's a pretty good solution that a lot of ERs have tried to come up with to that problem. So again, I would say if you're in doubt, don't worry about that. You can always ask questions, if it's totally appropriate. I've had people ask me before, like, next time if something like this happens, would it be okay if I make an appointment with my primary doctor or if I go to an urgent care? It's totally fine to ask those kinds of questions. A lot of times patients will like to avoid the ER if they can as well, because we do have long wait times, as anyone who's ever been to an ER can attest to. So, yeah, those are things that are totally appropriate to do.
You've talked a little bit throughout the episode so far about some of just like, you know, preemptive prep, right? Like rather than thinking about all these things when an emergency may be happening, if you've got a primary care physician in advance that you could maybe go to before urgent care, or you have kind of knowledge about the symptoms that may suggest going to the emergency room versus urgent care. And what your insurance looks like, where urgent versus emergent care is located. All of those things I think are so excellent as far as what people could do in advance and just know beforehand. But one of the things that we've talked about frequently on the podcast is that there's a lot of millennials who don't necessarily have like a primary care physician.
Mhm,
And I was curious if that can also have an impact on their care. I know you said a primary care physician knows you best. So
mhm.
does that affect these situations as well?
Yeah, I do think you have many more people who end up in the urgent care versus ER decision bucket when they don't have a primary care doctor that they're able to even go back to. And even more than that, like if they have a condition that's chronic and it's not being managed regularly by a primary care doctor, then they're more likely to end up in an urgent care or in an emergency department. And I think that's another reason why we see these big wait times in emergency departments too is it's kind of a downstream effect of not having a more robust primary care system and people having those good relationships with primary doctors across the board. But one of the big things that we do in the emergency department is we try to make sure that people are able to establish that kind of relationship. So one of the things that we do is try to set people up with a primary care appointment when they leave the emergency department, especially if it's something that's going to need follow up. Uh, and we kind of view that as a big part of our role is we don't just want to take care of the problem today and then pretend that it'll never happen again or that it'll go away or anything like that. We're trying to give patients a really good plan for how to manage things in the future.
Yeah, that totally makes sense. And if there was one thing that you wish millennials, younger adults knew about navigating the healthcare system in an emergency, what would that be?
I would say I think if there's one thing to take away, then I would say if you're truly worried that something could be life threatening, then don't hesitate and go to the emergency department. I think when we were talking about the other things that you could do to better prepare yourself, I think thinking about having a primary care doctor before you even really feel like you need it is a good idea. And then also just kind of knowing the lay of the land in your general area as far as the urgent care options and the emergency department options. You also, I think it's a big ask to have most people really go to the ACEP website, the American College of Emergency Physicians website, and read through what each, you know, which complaint should go to which place. But I think it makes sense if you have a chronic condition like asthma, just kind of think through ahead of times, like, well, when might it be appropriate for me to just go to this urgent care over in this shopping center that I know versus when is going to be my trigger for, this really feels like it's not funny and it's more severe. And this would be a time where I'm going to drive to the emergency department or call 911 and be, you know, monitored medically while I'm going to the emergency department.
Yeah. Is there, this is obviously going to be different for every person because, they have different baselines, but is there a golden rule that you have for people deciding, yes, they should be going to the emergency room?
I think that if you are worried to wait for a couple of hours, and that's a sign that something more severe is probably going on. So it probably is a good idea to get yourself to an emergency department. And if it's something where you're worried to wait even a few minutes, that's what 911 is for, because you're not just receiving transportation to the emergency department, you're receiving trained medical personnel to actually come to your house sooner and start some of those interventions like even earlier than going to the emergency department.
Perfect. And you've noted several different resources already throughout the episode, but if there's any other places that listeners could go to learn more about making kind of healthier choices, especially when it comes to this sort of care, is there anywhere else you'd recommend?
So one of our other kind of governing bodies that we have in emergency medicine, in addition to ACEP, is EMRA, which is the Emergency Medicine Residents Association, but they have some resources as well for people to check out. And then I think really because it is so facility specific and location specific, I think just checking out the websites of your local urgent cares could also be helpful in letting you know what's out there.
Well, thank you so much, Caitlin, for joining the podcast today. We really appreciate it. I think this is such an important and informative episode. We just see so many people talk about this, and I think it's very much one of those scenarios where when you're in the heart of it, it can be really nerve-wracking to try to figure out what to do and where to go. And so um, this is absolutely one of those topics where everyone should know it, everyone should listen, share with your friends, with your family, just to be prepared, just in case.
Thank you so much, Julie, for having me on. It was really an honor to be able to talk about these things, and I hope that it's helpful to somebody.
And if you're listening right now and you've really enjoyed this episode, it would be amazing if you can like, share, and subscribe to the podcast. We also are collecting feedback on the podcast to hear more about what other people want to listen to. So you can go to the link in our show notes to answer questions on a short survey about what you do or don't like or new topics that we could highlight. Any answers you provide would be greatly appreciated. So thanks for tuning in, and we will talk to you next time.